Hi, Dr. Robert Arnone, Upper Cervical Specific Doctor, Head and Neck Injury Specialist, focusing mainly on concussions, Post-Concussion Syndrome. Here to talk with you today about some basics and hopefully answer a question for you that some of you may have, and that is, how do I know if I've had a concussion? A lot of times if it's in sports, especially these days, there's going to be the coach that's had training, there's parents around, there's hopefully a trainer, assistant coaches. It's just more aware these days, so people are going to notice more, and you certainly can ask someone for help. But let's say you're not sure, or they don't know, or there's nobody to help, and you just want to know. Well, you're going to look for the basics. We did this in another video where we talked about the levels of concussion, the differences of concussion, the grades. So we're going to look right now at a grade 1. Likely if you're a grade 2 or 3, you would know it because they're more severe. So let's just start with grade 1, and that's going to be like temporary confusion, possibly dazed, unable to think clearly the way you used to. If there's someone else around, maybe trouble following directions. So an alteration in brain function is the definition of a concussion, and so it's maybe hard to notice that. You could have a headache that you didn't have before. That's possible. There could be some dizziness. There could be some things where you just don't feel right. So that's different than I got hit in the head and I feel fine. I feel exactly the same. There's nothing different. That wouldn't necessarily be a concussion, would it? But when you have the hit to the head, neck area, and there's some of these changes, then you've likely had a concussion. Usually once that happens, if it's mild, you can likely get away with coming to the upper cervical doctor, like myself, and finding out where the injury is and getting it fixed and corrected. If you want to be safer about it, or you're worried, or you think there could be more to it, and usually that happens with the grade 2 and 3, but even if you're a grade 1 and you're a little concerned, it's not a bad idea to go to the ER, go to your primary care physician, go to urgent care, go to a sports clinic, sports medicine clinic, somewhere where they're going to be able to evaluate you and make sure that there isn't anything worse or more going on. And again, we do that here as well, but you're welcome to do that elsewhere. I encourage that. I love when people go and have pictures done, MRI of the brain, and they rule everything else out. They say everything looks good, and then we can get to work with what we find the problem is and help the person get better. So it's not a bad idea to go get checked out, okay? Especially when you're dealing with brain and head and neck. It's the most important part of your whole body. Let's make sure that everything's functioning the way it should. And then you can contact me. We can talk, see about you coming out here, or if you're really far away, hopefully finding you somebody wherever you live or within a few hours of where you live to be able to see for help. Okay? So reach out to me in the comment section of this video, and I'll answer any questions you have. Until then, take care and God bless.